Hi everyone, my name is Shaidi Manyakat-Pinila, and today we're going to discuss pharmacogenomics. Pharmacogenomics refers to the entire spectrum of genes that are involved in determining a patient's response to a particular drug. An example of pharmacogenomic study would be one that examines the interaction between cytochrome P14 genes, beta-1, beta-2, alpha-1 and alpha-2 adrenergic receptor genes, and drug transporter genes on the response to carvedilol. Few reports of gene-drug responses in veterinary medicine are pharmacogenetic in nature, while dramatic alteration in drug response have been identified through pharmacogenetic studies. A patient's overall response to a particular drug will likely require a pharmacogenomics approach to characterize the individual distribution of multiple genes to drug response.